everyone. We are extremely happy to be here. My name is Christopher Walker, Senior Program Analyst for National Environmental Health Association, and I am here with a few of my colleagues to support Children's Environmental Health Day. In our support, we will discuss the COVID-19 Early Care and Education Project funded by CDC, where a collaborative approach was used to develop resources to support early care and education providers and other stakeholders. This project, titled Supporting Environmental Health Capabilities and Engagement in COVID-19 Response Efforts in Early Care and Education, brings COVID-19 resources to early care and education providers. The need for guidance on cleaning practices is especially necessary for early care and education facilities, where many children spend a majority of their active hours during the day and may be at increased risk for exposure to COVID-19 and other environmental health hazards. Resources developed from this project will give early care and education providers and health departments the ability to improve environmental health for children during COVID-19 and supporting their critical roles in protecting children's health. We have here today members of the collaborative and supplemental state projects representing their organization to help in the discussion. Let's meet them. Please introduce yourselves.
Great. Hi, everyone. My name is Hester Paul. I'm the National Director of our Eco-Healthy Childcare Program at the Children's Environmental Health Network.
Hello, my name is Ali Aslam. I'm a senior analyst on the environmental health team at the Association of State and Territorial Health Officials.
Hi, my name is Angana Roy. I'm a senior program analyst with the National Association of County and City Health Officials.
I'm Sarah Goodwin. I'm a policy analyst at the National Center for Healthy Housing.
Hi there, my name is Allison Buck Priddy, and I am the Health Educator and Community Involvement Coordinator for the Ohio Department of Health Health Assessment Section, which is the title of our APSDR Apple Tree program.
Awesome. So happy that you all agreed to participate in this discussion. Now let's get to it. Our first question, how important was it to develop resources for early care and education providers during COVID-19? And we will start with Children's Environmental Health Network, Hester.
So the issue of the COVID pandemic was that it highlighted the importance of environmental health issues and best practices more than we've ever seen before. And so in the onset of the pandemic, people were reacting, trying to figure out what to do with ever-changing guidance from the CDC and other places. So it was important to have a grouping of national entities come together to develop resources and making sure that there was continuity between the best practice recommendations, so that no matter where a child care professional would look to their kind of respected national entity, they were receiving the same guidance of what to do in order to stay open as a facility. So as a whole, we saw that a lot of individuals in the child care industry actually closed their doors initially. Some of them were able to stay open, but it was very important for them to understand what they could do to keep children safe and also keep parents from being concerned that their children might be exposed unnecessarily to the pandemic. So I think it was very integral for all of us to come together and create resources so that they felt supported. Another interesting fact is we found that family child care facilities were able to sustain staying open more so than center-based facilities. And I think one reason for that is that they're small, and so they were more easily able to kind of adapt their practices to meet the best practice guidelines that were being put forth by the CDC.
Yes, and just to echo Hester's comments, NACCHO does a profile study every few years and has found that local health departments often work closely with childcare facilities and schools. And so we found that even from the sort of local public health perspective, it was important to have accurate guidance on what should be going on in children's environmental health and daycares during COVID, particularly because, as Hester had also said, there was a lot of, especially in the early days, just a lot of conflicting guidance, a lot of new information emerging. And so making sure that we had one sort of reliable source for all of that information was really important for our members.
Yes, we know what happens when we have conflicting information going across. So I definitely can relate to that. I would love to know, Ali, what's ASTHO doing, or what do they do in response to resources created?
Sure. So yeah, we definitely also think it's incredibly important to develop these resources to protect children and staff in ECE facilities. ASTHO has been pretty busy, like a lot of other organizations throughout the pandemic, developing resources for a range of public health concerns. So we also think it's important to support state efforts because in many states, state health agencies are the ones who are engaging with the facilities through environmental inspections and also serve as a really important resource for ECE facilities. So supporting state efforts in developing the much needed guidance around food safety, cleaning, disinfection, and indoor air quality definitely is a priority for ASTHO.
Awesome. Thank you for that. We're now going to go to the next question. How were you able to adapt from initially developing resources, working on cleaning and disinfection and food handling to converting to indoor air quality and ventilation? And as for NEHA, I remember attending a listening session on COVID small group call facilitated by Hester at Children's Environment Health Network. This virtual call included a few early care and education providers that were looking for guidance in dealing with indoor air quality to protect from COVID. We later had kind of a one-on-one meeting with Children's Environment Health, and Hester reaffirmed kind of the need for indoor air quality guidance for early care and education providers. So seeing that gap in need, NEHA, we decided to work towards standing in the gap, where we developed a checklist, as well as it included recommendations to check for improving indoor air quality. And we also had a needs assessment or field assessment that we were able to incorporate some of those same questions to make sure that we were mindful of indoor air quality and ventilation. So that's what we did on our end. I'll go to Sarah. Sarah, what was some of the ways that you adapted to have indoor air quality?
Sure. So, as NCHH was creating a healthy homes guide for cleaning and disinfection, we had always planned to include a ventilation section kind of in our outline of that guide. So, as the focus sort of shifted to indoor air quality and ventilation, we just really kind of shifted our focus then to emphasize that section kind of among the other things we had been working on. And then as we finalized the original guide and moved to developing additional materials, we focused them more around ventilation to kind of reflect that kind of changing science and guidance. We tried to sort of de-emphasize cleaning and disinfection as the primary strategy and move toward kind of our providing guidance and messaging for how to do it safely and effectively as part of this larger strategy to combat the virus, that included wearing masks and social distancing and then properly ventilating. And I would also just wanted to say that kind of throughout this process, the frequent conversations we had with NEHA and CDC, as well as with the whole collaborative, were really helpful for us sort of checking in about that shift and how others were reacting to it and what new materials they were going to be putting out so that we could kind of get a good picture for how all the different organizations were kind of reacting to that changing science and guidance.
Awesome. Thank you for that. Yes, the collaborative was extremely beneficial to just having that conversation in a group format. Just to see what was done at the state and territorial officials, we'll go with you, Ali. What did you have?
Yeah, for sure. So ASTHO convenes a few different peer groups, but one that was pretty instrumental for our transition to addressing the indoor air quality piece was convening a group of state environmental health directors. So states and territories have been able to come together as a part of this peer group for a long time, even prior to the pandemic. But during the pandemic, we were able to facilitate conversations with these EH directors to talk about emerging issues throughout the pandemic. And this was one of the issues that had come up. So we were facilitating conversations and we were able to keep a pulse of how these EH priorities were kind of shifting throughout the pandemic, conducting surveys, we did some polling activities. And so the data that we collected from our EH directors was really instrumental in helping us to shift in addressing the indoor air quality piece. And so once we identified that as a priority, we really shifted to compiling federal guidance in this area and also collecting state best practices to help with some information sharing at the state level.
Awesome. Thank you for that, Ali. Now we're going to go to our next question. How were you able to put these resources together? And who did you connect with? And we're going to go to Allison with Ohio Department of Health. What relationships were cultivated and how important was collaborating?
Yeah. So I'll start out by saying that, as far as how we were able to put the resources together, we truly wouldn't have been able to do it without the collaboration piece of it. it truly was essential in our developing resources for schools and ECEs regarding cleaning and disinfection to prevent the spread of COVID-19. So to start off with, I mean, we relied on the sort of funding opportunity from our federal partner ATSBR to expand our typical authority to move more from environmental assessment to something that was a little outside of our wheelhouse. We also relied on federal expertise from agencies like US EPA and CDC, like a few others have pointed out, for the sort of ever evolving information that was coming out in the new science. That allowed us to actually develop the resources that we ended up putting together for schools and ECEs. So we needed things like information on cleaning products, safety information, alternative solutions in case, maybe name brand disinfection products were out of stock and they had to be made at home, that sort of thing. So federal expertise in that sense was really important. But at the same time, we also just as much relied on state and local partners, partners like the Ohio Department of Job and Family Services and the Ohio Department of Education, who are the two agencies in our state who oversee sort of the licensing and hold the expertise on ECEs and schools. We also relied on fellow ODH programs like the school nursing program. And really, like, these programs helped us reach our intended audiences and distribute materials. So, we sort of had some vague ideas about who we could, help us out, reach these audiences that maybe we don't always work with. And so, yeah, they were just really instrumental in getting to those audiences and getting our materials out there.
Awesome. Thank you for that, Allison. Is there anyone else who wants to respond to this question?
Yeah, I can respond to that question. So back at kind of the beginning of the pandemic, at the beginning of the project, we had started with just a scan of available guidance, which we organized into that outline I mentioned, kind of covering the different sections and audiences that we wanted to include in the guide. And that process was helpful because then as we went through the outline and developed each section of the guide, we got in kind of a rhythm with our review process with CDC and NEHA, where kind of as we completed each section, we could talk about just that section, with the experts and our partners at CDC and NEHA we were calling in to kind of go through and figure out if there was any adjustments we needed to make to that guidance. So we had that process set up for kind of every section, and then we asked other partners to review, as appropriate for more specific kind of questions or more specific audiences. So, for example, we asked CEHN to review the guide specifically for an ECE audience and specifically around those concerns.
So we first went to kind of our natural group, which are a lot of the national early care and education organizations and associations, and tried to get kind of our bearings on what information they had or what they needed. We also came to this collaborative to make sure we were giving consistent messages. But something I'd like to highlight that was particularly interesting for us was really engaging with the state health departments that received the COVID funding as well. So there were 16 different state health departments that received funding additionally. And one of the tasks that Children's Environmental Health Network had was to facilitate some small group discussions, which were really quite informal and just bringing groups together. They could opt in or out. Typically, we'd have about 5 or 6 states talking at a time, where they were sharing kind of best practices, they were sharing challenges, brainstorming together with basically how to either create a resource, use somebody else's resource that had already been created that would maybe be nationally applicable and not necessarily state specific. And then from there was brainstorming of how do you take a step further and really integrate these resources or these potential standards or best practices for the long term. And so just supporting departments of health and understanding how to engage maybe more comprehensively with childcare licensing or state-by-state quality rating improvement systems, so that once we know what the best practices are around cleaning, sanitizing, disinfecting, or ventilation, how do you take those best practice standards and set them into the systems that already exist for early care and education, so that you kind of have these strategies for the long haul, which I think is the hope for all of us, is that we don't want just these environmentally safe practices during the pandemic, but maybe a silver lining is that there's greater attention to these environmental health issues, and we can integrate them into standards so that anybody who's licensed within a specific state would have to adhere to, making sure that they're paying attention to the particulars that need to be paid attention to.
Awesome. Thank you for that. And I think we're reaching our time limit. But thank you all for the wonderful discussion. Thank you for all you've done in the collaborative. I would like to thank all the panelists. You've just been awesome just for all of the resources that you've created in real time. For those listening, thank you for taking the time to see the hard work from these great organizations, as well as the benefit of collaboration. As I close, I want to acknowledge that this project was supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by CDC or the U.S. government. But thank you all so very much for being here, and we're so happy to support Children's Virtual Environmental Health Day. So thank you all very much.
Thank you.
Thank you.